You already talked a little bit earlier about the length of time it takes to get an athlete back to play after an ACL reconstruction. What are the criteria that you use other than those time frames to say, okay, you've had an ACL reconstruction, you're ready to go back to your sport?
Well, one, you have to have probably 90% quad strength and hamstring strength compared to your opposite knee. Two, we have criteria about, how far a single leg jump you have to do. You have to finish the whole running program. And when you complete all of the rehab, those patients are not, should I say, ready to jump in as if they were fresh, because we can't reduplicate in a physical therapy setup all the things that they have to do on the field, such as football or soccer, or even basketball, because those things happen so quickly and so fast that that there is a time when you release them, you're releasing them to go back to practice, to redevelop their proprioception, redevelop their abilities to cut and react to somebody coming to them. There's another thing which I call the elastic component of the muscle. And what I have them all doing as much jump roping as possible.
What is the benefit of the jump roping?
Well, I think it gets it's just like jumping off the box, except you're doing it at a much faster rate. Jump roping, you have to be very quick. You have to be very quick. Your proprioception has to be very quick. Otherwise, you're going to trip on your jump rope, maybe tear the ACL in the other knee.
Now, we mentioned the use of a brace and non-operative treatment for athletes who tear their ACL. What about after they've had their ACL reconstruction? Is wearing a brace something you recommend when they return to their sport to help protect their knee and the reconstructed ligament?
Actually, I never use a brace post-operatively unless the patient wants it. Because, number one, all the biomechanical studies have clearly shown that the forces are so much greater which they see in just normal everyday cutting than that brace can control. Second of all, I don't want them to be brace conscious. I want them to to believe and feel that their knee is normal. Otherwise, I worry about the subconscious where they're going to favor that knee, and we know for a fact that the incidence of tearing the ACL in the other knee is 7% higher. So
after they've had an ACL reconstruction in their other knee.
Right. And so I want them to be back and feel like they're normal and react as they're normal. So I really don't use post-op braces or functional braces.